Hello, welcome to this presentation from Myopia Profile on children's eye health and screen use. This is part of a series of presentations for Myopia Action Month aimed at helping eye care practitioners understand and communicate the key messages of myopia management. My name's Ailsa Lane. I'm a contact lens optician from the UK. I've been working with Myopia Profile for over 5 years as an educational content developer. There has been increasing awareness of myopia over the last few decades, but what do we know about the prevalence of myopia before screens and digital devices became commonplace? An investigation led by Brian Holden used data published since 1995 to estimate the global prevalence of myopia. In 2000, before tablet and smartphone use was widespread, it was estimated that nearly 23% of the world's population were myopic, with nearly 3% of them being highly myopic. As we're all now aware, the exponential trend predicts 50% of the world's population will be myopic by 2050. But how do screens and electronic devices fit in with this trend? The estimations tell us that while screen use has certainly increased near work and may contribute to rising rates, myopia was already present and rising globally before digital devices became part of our daily lives. Research has shown that the real risk of myopia and screen use may come from a combination of sustained near work, long periods without visual breaks, and reduced outdoor time. A study from China showed that each extra hour of near work per week raised the odds of myopia by about 2%. The Singapore SCORM study found that children who read more than 2 books a week had about 3 times the risk of myopia. Another study from Asia has linked near work to faster axial eye growth and myopic shifts. However, the time spent on these tasks is only some of the story. The working distance of the near work is also important. Children who habitually hold reading material closer than 30 centimetres have a significantly higher myopia risk. And it isn't just screens that are held close. Books, homework, playing music and crafts all count as near work. Although studies have found that extensive near work is a risk factor for myopia, what they haven't conclusively stated is what kind of near work is riskier. There may be a replacement effect where digital devices have simply replaced book reading or other close activities. What is clear about many near work activities is that they typically take place indoors when natural light is reduced or restricted. Myopia onset typically occurs during a child's school years, and some risk factors for myopia, such as their binocular vision status and parental myopia, are non-modifiable. Time outdoors, however, has emerged as a modifiable factor for myopia management, and as such, it's become an important focus for research. A meta-analysis from Asia examined the results of 13 different studies involving over 15,000 children aged between 4 and 14. They found that outdoor light exposure significantly reduced myopia incidence by 50%, spherical equivalent refraction by 33% or 0.15 diopters per year, and axial elongation by 25% or 0.08 millimeters per year. The study concluded that outdoor time of at least 120 minutes or 2 hours per day is the most effective outdoor time intervention. Another study which investigated the relationship of outdoor time and myopia was the Sydney Myopia Study. They followed over 4,000 children for 2 years and demonstrated that those who spent more time outdoors and less time on near work had the most hyperopic refractions, with the reverse also being true. More near work and less outdoor time means a lower level of hyperopic refraction. The study also found that outdoor time did not directly trade for near work time. Even the children with high levels of near work got the benefit of more time spent outside. There was also no association between indoor sport and myopia, which highlighted the importance of outdoor time as being separate from physical activity or sport. So, with the evidence that prolonged near work and reduced time spent outside can increase myopia prevalence, what can the COVID-19 pandemic teach us when children across the world were mostly confined indoors and attended their lessons online? A study in China assessing changes in myopia prevalence and refraction in schools gathered data over a 5-year period up to and including the COVID-19 pandemic. In the 4 years prior to the pandemic, the increase in myopia was relatively constant, with between minus 0.06 diopters and minus 0.11 diopters for 6 to 8-year-olds. The increase in myopia prevalence during this period is shown here. When the refractive screening could resume, a larger myopic shift of minus 0.3 diopters was seen over a period of only 6 months. Older children aged 9 to 13 showed a decrease of myopia prevalence and progression, despite reporting spending more time on screens for school learning. A study in Korea investigating treatment outcomes for children using low concentration atropine found post-COVID progression to be faster in children aged 5 to 10 compared to the older children aged 11 to 15. The author suggested that controlling the environmental risk factors for myopia were important even if the child was undergoing myopia control treatment. The implication from these studies is that younger children may be particularly susceptible to environmental influences. In our modern societies, digital devices are here to stay and have become part of our children's lives in some form. However, this leaves parents and practitioners trying to navigate the use of screens with the aim of avoiding unnecessary use, which may increase the total amount of daily near work and therefore reduce the time children spend outside as a consequence. The World Health Organization, the American Academy of Pediatrics and the Australian Government Department of Health recommend these daily screen time limits. They advise no screen time for children under 2 and no more than an hour a day for preschool children. The risk of myopia onset and/or progression involves multiple factors and not simply screens. The distance at which near work is held and for how long may be more pertinent than the device itself, and especially if outdoor time is limited. Eye care practitioners are in a key position to offer balanced and evidence-based advice and support to families. Increasing children's outdoor time and evaluating their near work are essential elements of a myopia management care plan, regardless of when a myopia control treatment option is introduced. The following infographic resources are taken from the parent-facing My Kids Vision pages. They summarise the advice parents need when considering making changes to their child's lifestyle. They should aim to encourage their child to be physically active outdoors for at least 1 to 2 hours a day, whilst also remembering sun protection, of course. Although research has shown that sunlight, rather than physical activity, is providing a protective benefit, the World Health Organization also advises avoiding a sedentary lifestyle. It's also important for a child's overall health and well-being. There are 3 simple rules to help manage near work distances and the duration of near tasks. Studies have shown that close working distances of less than 30 centimetres are associated with myopia. The elbow rule, where the elbow is held against the body and a book or tablet is held no closer than the elbow to hand distance, helps reduce excessive accommodation demand at near. The American Academy of Ophthalmology advises taking a break from near work every 20 minutes and look away 20 foot for at least 20 seconds to avoid eye strain. This has been shown to reduce the risk of dry eye and eye strain symptoms in young adults. The 2-hour rule limits the recreational use of screens to 2 hours a day in school-aged children, encouraging a more active lifestyle, hopefully outdoors. Myopia Profile's sister site, My Kids Vision, has a wealth of resources aimed at helping parents understand the impact of myopia on their child and how they can play an active part in managing their myopia progression. My Kids Vision has a series of articles on myopia and screen time for all ages, from babies and toddlers up to teenagers and young adults. Practitioners can direct patients and parents to the site for them to access information in their own time and feel assured the information they're accessing is evidence-based. Is from the Visual Environment Advice infographic on the Myopia Profile Clinical Resources page. The Managing Myopia Guidelines infographics have been compiled to support eye care practitioners having discussions around myopia management with patients and parents. The QR code here will take you to the resources page on the Myopia Profile website. The infographics use best practice guidance to provide both a clinical care reference for practitioners and accessible patient-facing information. They're regularly updated and free of charge to download to use in your practice. There is also a take-home brochure for parents and patients. For further practitioner reading on the associations between myopia, screen use and time outdoors, please visit the Myopia Profile website and use the search bar for more information on this or any other myopia related topics. The QR code here will take you to myopiaprofile.com homepage. Thank you very much for watching.